Okay, so keratoconus, this is what it is, how to spot it and how to manage it. So keratoconus is gradual thinning of the cornea, causing it to bulge almost into like a cone shape. Now this causes irregular astigmatism and a drop in vision that often glasses can't fully correct. It often starts to manifest in teens or early 20s and can progress over 10 to 20 years. Patients will often present with blurry vision, distorted vision. They might struggle with things like night driving in particular, glares, halos, and things like ghosting. Now, in terms of what you need to look out for, the red flag is really big changes in prescription, especially the SIL over a short period of time. You can use things like keratometry, K readings to actually measure whether it is corneal, the changes, but topography is the gold standard. On retinoscopy, you might see a scissor reflex, and on direct, what's called an oil droplet sign. In terms of the cornea itself, an early sign is something called striae, void striae, and they're really faint kind of lines on the cornea which indicate stress. Fleischer rings are iron deposits around the base of the cone, and in advanced cases, you might see what's called Munson's sign, which when the patient looks down, you'll get a V shape in the eyelid. Your risk factors are family history, Asian or Middle Eastern ethnicity, and it's quite strongly associated with atopic conditions, things like eczema and asthma. You want to advise patients to avoid eye rubbing, as this can cause it to progress faster. In terms of management, if all signs point to keratoconus, you do a routine referral to the eye clinic. Secondary care management involves things like corneal cross-linking, which is when they use UV to strengthen the cornea and aims to stop progression. In the meantime, they might be using things like scleral lenses or RGPs to get a good level of vision. With early treatment, the prognosis actually can be quite good. The patient can get a good level of vision and hopefully avoid or delay something like a corneal transplant. Let me know any questions and what I should cover next.